On 11th March 2020, the day the World Health Organization declared a global pandemic, the world changed. Workplaces, schools, businesses and lives were transformed.
I'm declaring a public health emergency of international concern over the global outbreak of novel coronavirus.
Prior to the pandemic, WHO worked closely with the Ministry of Health to strengthen Cambodia's health security system, including core surveillance systems and the rapid response team to detect and respond to acute public health events. These investments laid the foundation for an effective response to COVID-19.
On 27th January, Cambodia identified and reported its first case of COVID-19. The patient was isolated within 48 hours of his symptoms appearing and successfully treated.
Even before the first case, WHO activated its incident management system to manage readiness and response.
When you have the big emergency, you need a chief commander to make a serious decision. Because managing infection diseases like COVID-19 is about a serious risk-based decision.
On 13 February, the Westerdam cruise ship carrying more than 2,200 passengers received authorization from the Cambodian government to dock. WHO assisted the Ministry of Health to manage COVID-19 risk, including passenger screening, laboratory testing and quarantine.
WHO convened and coordinated within the UN system and multi-level health and development partners for the health response on a scale not seen before. To limit the health and socio-economic impacts of COVID-19, WHO served as the lead technical agency to support the Ministry of Health throughout the response.
We adapted more than 100 evidence-based guidance documents to the Cambodian context to inform national policies, decision-making, and technical and operational response.
Cambodia's response capacity has continuously improved, for example, from one national laboratory in February 2020 to 20 laboratories now being able to test over 12,000 samples per day.
Additionally, health staff can provide mental health and psychosocial support in routine healthcare to address the pandemic's toll on people's mental health.
COVID-19 affected the entire world at the same time, and every country faced challenges to procure essential supplies. In Cambodia, we facilitated provision of personal protective equipment, laboratory testing kits, oxygen, and other medical supplies.
The quick availability of vaccines was a game changer in the response, including in Cambodia, which has championed vaccination. WHO's leadership and technical expertise was instrumental for the vaccine rollout. Evidence-based policy advice from WHO facilitated prioritization of all healthcare workers and vulnerable groups, especially the elderly, for vaccination since the beginning.
Whilst responding, WHO prepared for large-scale community transmission, and now local health system and leaders are even more ready for the next emergency. Joint MOH-WHO field missions were conducted to advocate for local preparedness and response, including communication for health. We developed and guided training for over 3,000 rapid response team members on surveillance and contact tracing, and 7,000 frontline healthcare workers on intensive care and home-based recovery.
With WHO policy advice and technical guidance on sustained management of COVID-19, Cambodia reopened society to allow the economy to recover.
Throughout the response, WHO also supported to ensure the continuity of essential health services such as maternal and child health and progression on eliminating malaria.
COVID-19 will not be the last pandemic. We need to be better prepared for future health emergencies.